Breast reduction surgery and breastfeeding. Can you still breastfeed after a breast reduction? This is a question I get every time I consult on breast reduction surgery. Will different surgical techniques have an effect? Do the scars matter? And will removing more or less breast tissue make a difference? Today we have the answers. Hello everyone, welcome back to Associate Professor Dr. Pornthep Pungrasmi, a plastic surgeon from the BeContour team, experts in breast and body contouring. On our channel, Talk with a Surgeon by BeContour. In this clip, we'll discuss whether breastfeeding is possible after breast reduction and what factors might affect breastfeeding. Before we start, don't forget to subscribe, like, share, and hit the bell icon so you don't miss any great tips from the BeContour plastic surgery team. We already know that breast reduction surgery can significantly improve quality of life, reducing pain in the back, neck, and shoulders. It also boosts social confidence. About 85 to 95% of patients are satisfied with their results. But one topic of great interest and a question I get almost every time a patient consults for breast reduction is whether they can still breastfeed after the procedure. This is especially true for women of childbearing age or teenagers brought in by their mothers. A recent study by V.C. Nemeth in 2025 in the United States found that 55% of patients who had breast reduction surgery were able to breastfeed successfully. Compared to other studies, breastfeeding success rates after breast reduction range from about 52 to 65%. In comparison, women who breastfeed without having had a breast reduction have a success rate that's quite similar at around 60 to 70%. Another interesting topic for plastic surgeons, especially those involved in breast surgery, is whether the choice of nipple-areola pedicle can actually affect breastfeeding success after breast reduction surgery. If you recall, I discussed the concept of nipple-areola pedicles in the video called What to Know Before Breast Reduction to Prevent Nipple Necrosis. In that video, I talked about how the choice of pedicle can affect surgical outcomes. However, this particular study found that breastfeeding success after surgery is not actually related to whether the pedicle is inferior or any other specific type, superior or medial. There have actually been many studies on breast reduction and breastfeeding, but I'd like to highlight two key ones. The first study, from back in 2007, found that 57 to 65% of women successfully breastfed after surgery, and the type of pedicle had no impact. Another study is a meta-analysis conducted in 2023. It's a major study that reviewed 33 existing studies. It included a total of 1,535 patients, which is quite a large number. It found that 62% of women successfully breastfed after breast reduction surgery. Specifically, those with a superior pedicle had a 59% success rate. With an inferior pedicle, the success rate was 64%. A lateral pedicle had a 75% success rate. And if the pedicle was in a vertical orientation, the success rate was lower at 43%. For a central pedicle, the breastfeeding success rate was nearly 100%, though studies on this are still very limited. The paper ultimately concluded that the pedicle type does not clearly or definitively affect breastfeeding. What is crucial is carefully preserving the breast tissue beneath the nipple and areola so that milk can still flow. Another interesting topic that often arises is whether the amount of tissue that is removed during breast reduction surgery can affect a woman's ability to breastfeed. Studies have shown that the volume of tissue removed does not have any clear or significant impact on breastfeeding success. Additionally, so far, no studies have demonstrated that the specific type or pattern of surgical scar resulting from breast reduction surgery affects the ability to breastfeed. This is because breast reduction surgery primarily involves removing excess skin from the outside. It doesn't interfere with the breast tissue or the milk ducts at all. Therefore, it has no effect on milk production. Whether you have an inverted T, a lollipop, or a donut lift incision, none of these techniques impact your ability to breastfeed. Looking at various studies from the past to the present, about 60% of women can still breastfeed successfully after breast reduction, regardless of the pedicle's location. The amount of tissue removed doesn't matter as much as leaving enough tissue under the nipple and areola for milk to flow. Furthermore, the type of surgical scar is not related to breastfeeding success. If you have concerns about large breasts at any age, you can consult with a plastic surgeon. For anyone seeking information on plastic surgery, such as breast augmentation or breast lifts, breast reduction, breast revision, tummy tucks, arm or thigh lifts, or liposuction, don't forget to subscribe, like, and hit the bell icon. You won't miss any great insights from the BeContour Plastic Surgery team. Please follow our page, BeContour Plastic Surgery by Pornthep Pungrasmi, and visit becontour.com. If you have any questions, feel free to leave a comment. Thank you and goodbye.